Pledge allegiance, pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Okay. To consider and act upon the minutes of October 5th, 2020. Do I have a motion?
I'll make the motion.
I'll second it, Nancy.
Thank you. Any discussion? Hearing none. All in favor?
Aye.
Aye.
Aye. Passes unanimously. Next item, Anthony Calabrese is going to present with Gerald Foley. This is item number 4, to hear and consider and authorize the purchasing authority to enter into a proposed 5-year lease with the Steel Point Group, LLC, to provide all labor, materials, equipment, and all necessary for the complete operation of the food and liquor concession in the new clubhouse at H. Smith Richardson, Morehouse Highway, Fairfield, Connecticut, as detailed in the RFP 2021-13 for the pricing detail in the Steel Point Group LLC proposal for a total 5-year lease price of $318,547. Do I have a motion to approve?
I'll make the motion.
Okay.
Second it.
Okay, discussion. I guess we'll have Anthony present this item. Anthony, are you on the line?
I am. Good afternoon, everybody. Anthony Calabrese, Director of Parks and Recreation. You all should have the award recommendation resolution in front of you that outlines the process that we went through. Towards the end of September, we recommended, Purchasing Authority recommended the award of this project to Steel Point Restaurant Group, LLC. The way this was done was they put it out to bid. We had 3 submissions in August, and the Golf Commission sat and interviewed all 3 vendors, and they were all very different. They were all very reputable companies, local companies. All had great proposals, but in the end, Steel Point Restaurant Group was the one that was offering the highest fixed rent year over year, and honestly, the vision that was most in line with what the Golf Commission envisions up at the new clubhouse. So you should have the numbers in front of you. I know the total's $318, I believe, but the annual rents are start at $60,000. And I think if you guys all remember back when we were presenting this, we were estimating around $50,000. So these all came in a little higher than we anticipated, which is great. It just shows that there is a market for this type of restaurant up at the golf course. So I'm happy to answer any questions. Gerald Foley is on the line for he could help with any of the technical purchasing stuff, and we'll go from there.
Thank you, Anthony. Any questions?
I do, but I'll wait. Nancy, go ahead.
Go ahead. I'll listen to what you have to say first, Tom, and then I just have one comment or question.
First of all, I want to make sure, Gerald, is the RFP process the standard RFP process that we go through for town vendors?
Yes, this was. Yeah, because what we did is on this particular service, what we did was we have price was one of our criteria, or what we refer to as the financial benefit. But as Anthony alluded to, what we had was we had a series of other criteria. So for this particular project, we had the financial benefit. Then we had a secondary, not really secondary, but one of the other ones. We had the restaurant concept and design. We had menu, days and hours of operation, the respondents' team's qualification, their fit out, investment, and schedule, and then we had the strength of the bidder, and then the comprehensiveness of their proposal. So all those factors, which I'm going to make a comment to this, but it's a Steel Point. I made a typo when I submitted the recommendation, but it should be Steel Point Restaurant Group. But they came up as the highest among all the members of the the Fairfield, Golf Commission. And I reviewed the submission on my end, and I concur with their recommendation.
Gerald, do they have all the appropriate insurance and bonds and all that? Have you done the due
Yes.
diligence on the
Right.
financials?
So on this one, what we're doing is what this is typical with our concessionaires, is we're going to have that company, the Steel Point Restaurant Group, they're going to be required to basically submit as a we don't have a bond, but we take a security deposit from them, and that'll be due before they can actually basically move into the space. But we don't. But it's kind of, I wouldn't say necessarily in lieu of, but it's kind of a replacement of a bond.
Okay.
We don't have a bond, but we do.
Yeah, I'm getting some feedback, I guess.
I know.
on
I hear that too. Right. It was like
sounds like
repeating
you.
it. Yeah, sound like I was repeating myself. Yeah, so we're going to ask for a security deposit from them. We'll have all their insurance in place. We actually work with the town's risk manager to craft the insurance requirements, and so far everything is all in line.
Can you step us through? Thank you, Joe.
You're welcome.
Anthony, can you step us through when you say, hey, the concept was in line with the Golf Commission? Just briefly tell us about the concept so that we're aware.
Yeah, essentially, what the Golf Commission wants to see up at the golf course is a restaurant that is going to bring in clientele, customers, families from the surrounding area, and not just golfers. So they wanted a group that's going to be able to cater to the golfers during the day, and then say after 4 or 5 o'clock at night. And the weekends, essentially be a restaurant that, people are coming from, Easton, Trumbull, up the line, and rather than driving all the way down Black Rock Turnpike or to downtown Fairfield, that they're actually stopping at the golf course. And they envision, events and all kinds of stuff throughout the winter months, too, when golf is not typically taking place due to the weather.
And okay, so they did all that. They agree on all of that. Is that correct? That's their concept?
That is correct.
I thought that the
I'm
documentation
on
that
if you would like me to add to it.
Go ahead.
Sorry, this is Keith Varian. I'm chair of the Golf Commission, and I just wanted to echo what Anthony said, so I'm happy to elaborate if anybody has any questions on it.
Thank you. Perhaps you can, but I just want to say that I thought the documentation for this was very well done. It was easy to go through the package, understand what the process was, and understand the differences in the bids. So whoever put that together, I want to thank you for that. It was very helpful. And then I'll turn it over to Nancy, and if she would like more on the concept than that, that's fine by me as well.
No, you covered my questions.
Great. Thank you, gentlemen. I appreciate it.
You're welcome.
Okay, hearing no other questions, all in favor?
Aye.
Aye.
Excuse me, Brenda. It's Gerald Foley. I just had to make a technical correction or request for a technical correction for the name of the company. It should be Steel Point, and after the T and Point, they have an E, and it's Restaurant Group. So when I submitted it, I made the typo, and I have it repeated twice. I have Steel Point Group LLC, but it should be Steel Point. After the T, it's an E, and then the word restaurant. So the full name we should read Steel Point Restaurant Group LLC.
Okay.
I'll make the motion that we amend the contract to say the Steel Point Restaurant Group LLC.
I'll second it.
Very good. All in favor?
Aye.
Aye. Okay, back to the main motion as amended. All in favor?
Aye.
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 Motion carries and passes. Thank you, gentlemen.
Thank you very much.
Everybody.
Thank you.
Thank you, guys.
Thank you. Bye-bye.
The next item is to hear and consider and act upon any other business that shall properly come before this meeting. And I actually asked Dan Scleary to join us in the conference room, just due to a lot of the, concerns in our community regarding, what's going on with our numbers and all of that and all the work we've been doing. And I just thought it would be helpful for, both of you and for any public that was listening to get an update from Stan, so I'm gonna hand it over to him.
So, just to give a general update, and I'll leave time for questions. So, to start it off, you know, I think the key thing that people need to understand is we are in the start of the second wave of the pandemic. This started for the state of Connecticut probably in August. We've been seeing gradual increases since then, and then for Fairfield, it more likely started early September. So we are seeing increases in cases across the board. We are seeing, so we will be seeing likely more cases happening over the next several weeks. The question of where are we now? Right now, we just went over 1,000 cases this past week. We're about 1,015 cases, but that will change, you know, within the next 30 minutes when the state updates their website. But we're a little over 1,000 cases. 700 or so of those cases have recovered. 51% of those cases are in the general population. 28% are in elder care facilities, and 21% of that number is university-related cases. Right now, the average age is about 23. The median age is a little less than that, around 21. Last April, we were at about 75 years of age. So it's different, and this wave will be different in the sense that, you know, we're at this point going through this second wave of the pandemic with schools open in hybrid, with businesses open, with sports being played, and with all this additional activity going on. So it is challenging, but we're trying to essentially, you know, not to have this wave have a steep peak like in April, but to have a sort of a flatter, longer curve happening, and that's the goal of this, is to try and, you know, keep space in the hospitals and acute care facilities. So the impact this fall, if you look at our data page, you can see, and some of our graphs show that the predominant cases so far have been amongst university students. We've got Fairfield U has done about 6,300 tests. They've had about 415 cases. This is according to their dashboards. Right now, they've got about 158 active cases. Sacred Heart has done about 6,100 tests. They've had 304 cases. 62 of those are active right now. And so one of the improvements of this wave over the previous first wave is that testing is generally available, widely available. If you want to get a test, you can get it, and you can get it fairly quickly, and you can get the results back pretty quickly. And that the key thing to stress in terms of what's happening now is it's really small gatherings that are leading to transmission right now. It's things that aren't necessarily violations of the sector rules. It's people getting together in small groups in their homes or other locations, and not wearing masks, not staying 6 feet apart, and that's really where we're seeing the transmission. Up until this week or so, we've been seeing largely clusters of cases that are sort of related to groups. People that when you ask them, where did you get exposed, you know, and they know how they got exposed. I was with this friend who later tested positive, and so they have an idea. What we're starting to see now, this week and a little last week, is transmission amongst people where they don't know where they got it from. So we're starting to see more of that, not a lot, but a little, which is sort of the first indicator of community-based transmission is potentially occurring, which it always is, but we're seeing a little bit more of that going on right now. And so some of the things that once we get to community-based transmission, and even before, we are not likely to enforce our way out of this by writing tickets and fines and closing establishments. it's not likely to have a significant impact on this. It's really going to be the actions of individuals and the citizens, taking actions and steps to protect themselves and their families that will be the most effective. And one of those is, limiting attendance at events and small gatherings, especially those where there might be a temptation to get close to people or to take your masks off. And so limiting those types of interactions, along with the traditional ones of continuing to wear a mask, continuing to try to stay 6 feet apart, continuing to stay home if you're sick, especially if you are awaiting the results of a COVID test. You should be staying home and not interacting with the general population. And as well as just the basics of good hand washing, good hygiene, is the efforts that will be most effective in leveling this wave out and keeping it from taxing our healthcare system. So I'll leave it at that, and then open it up for questions if you want.
Can I just also mention, Sam, I think it's important to note that Fairfield University was doing targeted testing.
Yeah.
So they were literally targeting groups that they thought may, and I think that's why their number may have been a little bit.
Yeah, and so I can talk to that. I actually have it in my notes, and I meant to talk to about some of the actions the universities have taken to address the concerns. Both Sacred Heart and Fairfield U have locked down dormitories. They do specific targeted testing to populations that seem to be more highly impacted. So, for example, certain sports teams, certain dormitories, certain areas of residences. And so both of them have done that. For example, Fairfield U is currently going through, they have a dorm lockdown. They have restrictions on students at the beach from preventing them to come on campus. They've asked students at the beach area to stay home, to not go out unless absolutely necessary into the community. They've closed their athletic facilities. They've canceled all their sports activities, and they've asked, on-campus students not to go off and interact with the beach area students. And these are actions similar to what Sacred Heart took earlier in the season when they were experiencing a peak in cases. And Fairfield U is implementing similar steps. We've met with, on multiple occasions with both universities, with the state, and both universities have implemented all the recommendations that we offered and the state offered in trying to curb the increase in cases they saw.
And they also, some people think they're sort of abandoned these kids. They are following up with each of the students who are quarantined to make sure they have, they're getting food in Instacart, if they need something from a store. So they are supporting their students who are quarantined off campus. And so I know there's been a bit of concern from the community about the university cases and the concern of it spreading around our community. But at the same time, they are individuals, they are adults, and the university is taking a lot of steps that I don't think may have been conveyed maybe clearly enough to the public that they are taking it seriously. And I have outlined this in responding to emails to residents based on my newsletter last week when I shared the PSA, which we did. And I hope you had a chance to see it. I thought it worked. I thought it was really a good PSA to help, remind our young people in town, high school, middle school, and university, that, it's important for them to follow the rules. But at the same time, people were thinking that I had the authority to shut down the universities. I just want to say, for the record, I do not have the authority to shut down the universities. And the state of Connecticut Department of Public Health has engaged with them, as they do with all colleges and universities throughout the state, as does our local health department. And if the state of Connecticut thought that they were not following the guidelines that they had established, the Department of Public Health, they would shut them down. So I just wanted to say that. And so I'll open it up for questions.
Go right ahead, Nancy.
Yeah, thank you so much, Sam, for, do you feel, because I'm getting a lot of inbound concerns, frustration, fear, anxiety, that continues. I think that one of the main concerns is that Fairfield University is not responding adequately, that members of the community, of their community who've tested positive, who've been banned from coming on campus, are now left to kind of free float in the community at least that is a perception. So there's that concern. There's a concern that there is still a lag in data and that decisions are being made about the health and safety of this community based on a lag time of information, meaning positive tests at the Fairfield U community, maybe Sacred Heart. So how confident are you now in the response of the university, the information we're getting at the state level, et cetera, especially as we're talking about, you know, the restaurants opening in a different way and the schools going back to full-time at the elementary school level, and yet, you know, there is this perception that we're becoming increasingly, we're looking more like a bit of a hot spot. So can you talk about some of that?
Sure. So to address the first issue of students free-floating in the community. So students that are positive, just like residents that are positive, that live in the community, are instructed to isolate at their dwellings and not to interact with the community and with their roommates. Most of those students, according to Fairfield University, actually leave town and go back to either their permanent address at their parents' home or to other locations that the parents have available to them so they can isolate on their own. The students that are under quarantine, it's the same thing. They are just like Fairfield residents that are asked to quarantine. You're asked to quarantine, and police aren't going to your door and checking, and nobody's going to their door and checking to ensure that they're doing this, but we're asking people to do the right thing and to isolate and quarantine properly. Are people violating that? Potentially, but again, no one has the resources. This is what's going on throughout the country, is no one has the resources to check on every single case. So, but we are asking, and we are asking people to isolate and quarantine in their residences, and you know, the university is doing a great job contacting those individuals, especially the cases, every day to make sure they're healthy, they're fine, they have their needs met, and it's fortunate that this population is the population least likely to have severe consequences or acute healthcare needs as a result of this. So, in terms of lags in data, so you know, that's always the case with data. You know, we're never going to get to real-time data, so there's always lags and delays. But again, those lags and delays are improving as we get better. And the university, Fairfield University, is going to be updating their dashboard every day, starting today, according to them. Sacred Heart updates their dashboard every day. We update our dashboard every day with the latest data that we have, except for the weekends. We don't do it on the weekends. And so you will see some lags in data, because that's just how data works. And there's data corrections, and there's labs that withhold data, and so every now and then we get these dumps of data. So I think that was the two big questions you had. Was there others, Nancy?
Thank you, and I want to be clear, I am personally thanking you very much. As so many residents, I've also heard from, you know, how grateful they are to the health department and to you, and the contact tracing, how that has been impactful and effective. So in asking these questions, I hope you don't feel attacked. I hope you feel supported. I just wanted to make sure that residents' questions that I was receiving were getting answered. So sure. Thank you. One additional question that I got was with regards to access of and availability of testing. Someone mentioned this idea of, like, you know, the rapid, like a home kit, like equating it to a home pregnancy test, although maybe that's not a great analogy, but that idea of this kind of do-it-yourself home testing option, is that something that is being discussed at the state level as a possibility? Is there any update or further discussion on wastewater testing and testing broadly? Like, do you have more information?
So regarding testing, so the type of testing there, I am not aware of any emergency use authorizations for home COVID test kits yet. There are rapid test kits that don't require lab equipment that are being distributed, the Binacs now, that are currently being distributed by the state. It came from the federal government to the state to different entities throughout the state. That is a swab. It's probably, other than the saliva direct method that Sacred Heart has started using through Yale, this is probably the least invasive type of test. It's, a nasal swab just right in your nose, slid into a small card, a reagent is added, and then you wait for the test results, similar to like a home pregnancy test. And, that's sort of the easiest one. That's coming online. They're very affordable. And so, but they are antigen tests. And so antigen tests have limitations on them. And people who go to get testing need to understand the limitations on an antigen test. They're meant for specific purposes, and the state has a guidance document which outlines that. The gold standard type of test is to get a PCR test, and that's what we recommend people get, is a PCR test that is the better, more preferred test. There are some rapid versions of it that are available, but for the most part it takes 24 to 48 hours to get those results. But so that's my understanding right now of testing, and testing is getting better and more widely available each day.
Thank you.
Can I, Nancy, all done?
Yeah, go ahead. Thank you.
Sure. Number one, I wanted to say thank you for the PSA. I thought that was very well done. I know some of the people who put it together. I don't know who spurred it, but I think that was done well. Secondly, Sam, thank you for the update, and I'm glad to hear that you feel comfortable with what, at least at this point, the universities are doing to help with this. Third, I got a couple of questions / ideas that I want to bounce off you that may or may not be helpful. Number one, do we segregate and report out the data separate from this is what's coming from the university and this is what's coming from the rest of the population of Fairfield for purposes of deciding, as Nancy said, whether we are becoming a hot spot or not?
So if you look at our data page currently, and we'll scroll down a little bit, there's a graphic that's where I got my data from today that says, 20% of the cases are currently university cases, and there's an additional histogram that shows the breakout of general population cases versus university cases. So you can see from a trend perspective that, yes, this wave so far has been, for the most part, not entirely, but for the most part, because we had a similar cluster going on in Fairfield Ludlow High School a few weeks back. But for the most part, it's largely university cases that are driving at least Fairfield's cases at this point.
Is it fair to say with the exception of maybe some of our elderly housing and that the university population is the most tested population in town as well, and that could be driving some of the positives, right?
Yeah.
So we should expect that they're being tested so often that just by sheer numbers and sample size, they're going to have more positive tests than the general population, correct?
Yeah, and especially because they're doing, as Brenda had alluded to, targeted testing. So they are not only doing surveillance testing where they test randomly selected students, and they're getting very low positivity rate on those. I mean, out of, I think it was 534 tests last week they did one day, and they got 2 cases. So very low surveillance in their general population community. Then they're doing these targeted testing where they saw some increase in cases down at Fairfield Beach Road, and they have gone ahead and arranged specific targeted testing for Fairfield Beach area students located right in their area at the Jackie Durrell Pavilion, and they're doing the testing there and having the students come there and get tested. So they're doing hundreds and hundreds, 380 some odd students last week. They're doing it again, and so they'll be trying to test all those. And so you expect amongst an impacted population to have a higher rate. And so we are, and that's the goal. Similar to testing a dorm where you saw a cluster of cases, you test that entire dorm and you expect to find more cases, and the intent is to isolate those who are positive and quarantine those who are contacts.
So bottom line, I mean, what it's coming down to is having the universities in town on a normal basis provides a great deal of benefit to the town, both economically, culturally, quality of life. But in a certain situation such as this, It comes with the downside of the fact that because of lifestyle, because of the amount of testing they're doing, that there's going to be a higher incidence of positives in that school-age population. Fair to say?
Yeah, yes, I think, again, and given the demographics of that population,
Yeah.
and this is a particularly active social population
Right.
that presents different dynamics than families with children
But-
and elderly.
Right. So the other thing, number one, I think we should look at the data, and actually spur that out a little bit more to say the general population versus the school-age population. I know it was there. I just think that should be talked about a bit more. The third item that I would suggest, though, to allay some fears, or maybe the second item, would be to actually, I'd love to know if they're benchmarking against other universities. My son is in the school out of state, and they do similar testing every couple of weeks, and they do random testing. And it'd be interesting to know on a percentage basis how our two local universities are doing against either similar universities or a benchmarking of other universities to say, where does Fairfield U, where does Sacred Heart come out in terms of percentage of positives versus a more analogous group, which would be other universities?
Yeah. So we've looked at that a little bit. It's kind of hard to compare apples to apples in that regard, with some universities sending home entire classes and not having them on campus, and some universities doing other types of activities and the
Without a doubt.
the way they present their data is all different. And so it's very hard somewhat for us to look at and compare, and to know that we're comparing apples to apples when we compare data.
Well, I'd like to know how the universities are judging themselves then, and see if Fairfield U and Sacred Heart have a sample size that they're looking at based on their policies, based on the way they're managing their student body, and see if they think they're doing a good job as compared to that. What is their benchmark to say we're doing well or we're not doing well? I think that, to me, is a better discussion point as to, are the universities doing everything they can do versus, oh my God, they've got so many cases and all that. Because we just don't know. This is the first time we've been through this. That would be my thought.
Yeah, no, and I can look into that. We've had discussions about this, of how do we do this at the state? How do we draw comparisons? How do we know if somebody is performing effectively? And again, the state has, everybody's learning in this, and we're trying to come up with the better ways to look at the metrics, and the state is evolving. They just changed their school metric this past week, and so in their new town-wide alert, town-level alert system. So they're changing the metrics, evolving as we go on, and so I think that will come along. I mean, some of the things that initially we were looking at percent positivity as a gauge for the community in terms of overall testing. The universities were doing that alongside with us, and they were getting very low numbers. But that's their general screening testing. And then, as with other entities have experienced, you occasionally get this cluster of cases, and you have a little outbreak that you have to get under control. So I think that they're both working on the data side of it, and from what I've been told, their Fairfield U's data page will be improved significantly this week, and will be updated daily
it's just
to
what
address some of their concerns.
Yeah, it's just, to my point, based on everything you're saying as to the policy that they're following, the real question is, what are we benchmarking ourselves against, both as a town as well as the individual universities themselves, to say whether they're doing a good job or a bad job? And in the absence of getting that information out there, people are making up their own information, and as Nancy said, she's getting the phone calls and the concerns and all that. If we came out and said we have 2 universities in town, this is what universities are doing by and large across the United States, this is where Fairfield is, and this is where Sacred Heart is, that could help the conversation a bit more. That's all.
If I could just jump in, though, for a minute, Tom, as you know, and I'm sure you both are probably very aware, that our health department is literally running on fumes. I mean, they're working all the time.
Sure.
They're answering phone calls, going out and visiting businesses, following up on complaints, and I know that, you and Nancy may get some calls, but believe you me, you don't get the calls we get.
Oh,
And so we're
Brenda.
following up, with
Brenda,
all
let
of
me,
those. Let me just finish.
yeah, let me,
We're following up with all of that, and, I would say for the most part, it's not a huge percentage of our community. Some people are a little bit more, active than others, but I would say for the most part, I think the majority of our population town understands that, that we are in a pandemic, and as Sands, illustrated earlier, we had a little jump in cases at one of the high schools because of some events that happened, and now and then we had a jump at Sacred Heart, and they jumped right on top of that, and Fairfield U is similarly having that, and they're jumping on top of it as well. And I have reiterated this, repeatedly in my newsletter. The State Department of Public Health is monitoring every single college and university, on a daily basis. And so they are making very sure, and obviously they have a lot more resources than we do in the town, and will shut down the universities if they feel they are spiraling out of control. So I think that's really
Brenda,
important for everybody to know.
Yeah, Brenda, just to be clear, and thank you for pointing that out, and Sands, I hope you didn't take it this way. I wasn't inferring that that's something that the health department should be running down. I honestly believe the universities are already tracking this, because they have decisions to make and everything is measurable. So I cannot believe that Sacred Heart and Fairfield University internally are not tracking how they're doing versus similar universities, whether it be across the state or across the country, based on their policies, because they need to manage this as well. And all I'm suggesting is, and I hope they have that data, that would be useful information to share with the community so that that could be let out there. Because you do have the Department of Health for the town saying, as far as we know, Fairfield University and Sacred Heart are doing everything right versus the state, vis-a-vis the state programs, vis-a-vis working with our health department. They've been collaborative partners. We just want to see what the metrics are. And I think that's the easiest way to judge a university is how does another similar sample size do? That's my only point. Not to have Sands and his team have more work.
Okay.
So thank you.
Any other, questions or about any of this at all, not just the universities? No?
Not for me.
Oh, okay.
Yeah,
Nancy?
I'm set now. I mean, is there any other thing that we're not thinking that the public should be made aware of in terms of, businesses or how you're working with the public school, with the elementary schools, the high schools, any of that? Is there something?
So we are working every day with the Fairfield Public Schools and the private schools every single day. Our contact tracers are, tracking down every case, every contact. They're advising the schools of those contacts. So you'll see on the Fairfield Public School website all the different individuals that are cases and quarantines listed there, the schools that are impacted. So that is going on all the time, and we're working with them. Myself, my staff, Mark Barnhart, and zoning are working with all the businesses on a regular basis to, ensure that they are, that we're assisting them in ways that they, to help their business functioning, and also between fire and police and the health department, making sure that they're following the rules, the sector rules that they're supposed to. And so we're responding in both sides of that, trying to help them and trying to make sure they're doing the right thing.
Are we thinking ahead, or are you thinking ahead? Let me rephrase that. I'm sure you're thinking ahead to the colder months, which seem to be, hard to think about today, but cold is around the corner in terms of businesses and outdoor dining and all of that. Is there kind of a next plan for that?
Yeah, so the state and zoning, and our team here is working on some of the guidance around being able to add tents and to loosen regulations locally and at the state level to allow activity to happen in tents with heaters and things like that, and do it safely, and count that against their indoor dining numbers. So that is going on. They're planning for that right now, but there's some questions that are posed at the state level that need to be answered first.
And just to follow up on that, Nance, we've been working with the businesses from the very beginning, the emergency management team, and trying to be as helpful as possible to them and aggregating information from the state, and then coming together as a team and planning each and every detail and making sure the businesses understand the sector rules that come out with each phase, and then sharing that information, and then in being helpful. Like, for example, all the permits that we processed for restaurants, for outdoor dining, we waived all the fees. We jumped on them, turned them around in 2 days or less. So we're jumping on top of this to help them in any way possible to make sure that they can operate their businesses, but obviously in a safe way. And also to the point where when we get complaints about restaurants that may have too many people hanging around outside waiting, or maybe people aren't wearing a mask or something to that nature, we get that right away. Typically that's an email to me, or it's a call to Sands in the health department, and they send people right out. So there's a lot of activity happening, and we're just trying to be on top of all of it. And the emergency management team really handles these things on a daily basis.
So I have two final questions. One is, and it's not really a question for today, it's when a vaccine does become available. I know at some point down the line people are going to be interested to hear about what Fairfield's plan is for that. But with regards to COVID and the election and voting on November 3rd, can you talk about the protocols and from a COVID perspective? Well,
I would just say we could potentially bring up the next one, but we are following all the protocols that were outlined by the state, and we had a test run during the primary, and that went very well. It was very safe. It was run very well. I went out myself and visited several of the polling locations and watched the operations, and I've been in contact with Betsy and our town clerk's office, and they are processing a ginormous amount of absentee ballots applications. They're working late at night, working on these and processing them. So I think a lot, we have the 2 boxes outside of Town Hall, and people are dropping them off very consistently or mailing them in. So we have the protocols in place as established by the state of Connecticut, and the Registrar's Office has implemented those through the primary, and they're going to be doing the very same for the general election.
Right, but no one will be made to go inside it, like there is, that still will be that outdoor voting option at each polling place?
I believe so. I think they're doing curbside.
Yeah.
As we did that for the primary, so I can't imagine why they wouldn't do that.
Okay.
And to address the mass vaccination point, we are already starting the planning process. We've already been meeting with the state on all the criteria and the agreements that are required. We do mass vaccination every year at the health department through our flu vaccination clinics. We can do thousands of people a day. And so the plan is that we will follow the CDC guidance in terms of when shipments arrive. There'll likely be small lots, so we'll get hundreds, not thousands at first, and we'll be vaccinated according to the priority groups specified by CDC and the state. So we're already starting those planning efforts. We're ready to go.
And if neither one of you have had your flu shot, I went and had mine today down at our health department, and it was fast and easy.
I've done it.
I had mine.
Awesome.
Slightly unrelated, but somewhat, in terms of the election, perhaps we can also add to next time's agenda a more broad, because we do have one more meeting before the election, is my understanding. Maybe we could talk about just what that will look like, because some people have brought sort of some of their concerns outside of COVID for election safety. So it would be my request that we can talk about that in greater detail next meeting.
Okay, I just wanna it was in our newsletter, we actually put a big thing about voting in the newsletter,
Yep.
that has all that information,
Just one more
About-
avenue to talk about it publicly, that's all.
Any other items?
That's it for me.
Thank
Right
you,
now.
no,
Okay. All right.
Thank you.
Sure, absolutely. And, anytime, you have any questions, feel free to, if you have any questions regarding health department issues, feel free to email Sands, and ask them, so that you can share that, broadly if you get reached out to by anybody who's not reaching out to my office. And of course, I'm always available if you ever have any questions, or Jackie or Tom.
yes, both make themselves all of them make themselves readily available, I appreciate it, I do exercise that, for sure.
Awesome. All right, well, I think we're done, so I'm gonna ask for a motion to adjourn.
So moved.
I'll second it.
All in favor? Aye.
Aye.
Okay.
Take care, everybody.
All right, thank you. Have a good night.